In this video, we'll discuss what is a repetitive strain injury or RSI. We'll first go over the various names under which this condition is known. Then we'll discuss how organizations such as the US Bureau of Labor Statistics define RSI, and I'll tell you why I believe these definitions are inaccurate. We'll then review the most common symptoms associated with RSI, and I'll finish the video by going over the most common types of RSI, such as carpal tunnel syndrome and a few others. Repetitive strain injury, or RSI, goes by many different names. It's sometimes called repetitive stress injury, musculoskeletal disorder, motion injury, ergonomic injury, occupational overuse syndrome, mouse arm, or overuse injury. The term used in the medical literature tends to be musculoskeletal disorder, but the term repetitive strain injury, or RSI, is by far the most widely used on the internet, and usually even your doctors might be referring to repetitive strain injury. The US Bureau of Labor Statistics defines RSI as injuries and disorders to muscles, nerves, tendons, ligaments, joints, cartilage, and spinal discs. This definition is pretty standard and is similar to most other definitions of RSI that you will see out there. Let's look at another one, this time from the UK's National Health Service. Now, the NHS defines RSI as a general term used to describe the pain felt in muscles, nerves, and tendons caused by repetitive movement and overuse. The problem with these definitions is that they leave out one of the most important elements of RSI, and it's the duration of the symptoms. You see, with RSI, pain and other symptoms tend to be chronic, meaning that they don't go away on their own like other problems would normally do. For example, if you go to the gym, lift some weights, and hurt your elbow, this would not be considered RSI. Why? Because after taking some rest, you would most likely fully recover and be back in shape. Not so with RSI. In fact, I recently conducted a survey among people who suffer from RSI, and the results were very interesting. I asked people, among other things, how long they had had their symptoms for, and the answer, frankly, surprised me. As you can see here, 58% of people responded that they had had their symptoms for more than 2 years, and 26% between 1 to 2 years. This means that for this sample, 84% of people had been suffering from RSI symptoms for more than a year. Personally, I suffer from RSI from over 2 years. So in my view, and based on additional research that I've conducted, I believe that an accurate definition of RSI should take into consideration the chronic nature of the pain. Let's turn our attention to the most common symptoms of RSI. There are lots of them, but they typically include the following: sensations of tingling, numbness, burning sensations, pins and needles, swelling, dull or sharp pain, loss of sense of touch, loss of grip strength, unusual sensations in your thumb and fingers, and trouble straightening one or both arms. Basically, if your hands, wrists, or forearms hurt, lose feeling, tingle, burn, ache, or feel stiff, that is probably RSI. You can also have RSI in your elbows, shoulders, jaws, and a few other places over your body. It's important to emphasize that RSI is not a disease or a genetic disorder. RSI is simply an injury or pain in the human musculoskeletal system, and as such, it can be treated. But in order to treat this pain, you need to understand and address the root cause of the problem, as well as factors that sustain the pain. Thankfully, you don't need to undergo surgery, take painkillers, or pay for expensive therapy to achieve this. This is something I discuss in detail in the Finally Pain-Free program, which you can learn more about in the description of this video. One of the most well-known types of RSI is carpal tunnel syndrome. Doctors believe this syndrome is caused by pressure on your median nerve, which runs the length of the arm, goes through a passage in the wrist called the carpal tunnel, and ends in your hand. Common symptoms of this condition include numbness, tingling, or weakness in your hand. As with other RSIs, carpal tunnel syndrome symptoms usually start gradually and worsen over time unless the root cause of the problem is addressed. Keep in mind that besides carpal tunnel syndrome, there are many other conditions that fall under the umbrella of RSI. They include tendinitis, tennis elbow, trigger finger, de Quervain syndrome, cubital tunnel syndrome, and the list goes on. The conditions I've just enumerated are also known as type 1 RSI. But what if you suffer from pain that covers an entire area, such as your forearm and hand, and doesn't fit any of the categories we've just discussed? Well, it turns out there's also something called type 2 RSI. It's also known as diffuse RSI, and it's sometimes referred to as non-specific pain syndrome. Type 2 RSI is somewhat of a catch-all term for types of RSI all over the body or all over a certain area, such as your entire arm or hand. An example of type 2 RSI would be peripheral neuropathy. But again, diffuse pain all over your forearm or hand would also usually qualify as type 2 RSI. For both type 1 and type 2 RSI, people typically don't have demonstrable physical signs of injury. A physical sign of injury would include inflammation, and if there really is inflammation, you would usually show symptoms such as localized heat, redness, or swelling. If you don't show any such signs, your doctor probably won't be able to diagnose a medical condition from your symptoms because there are no obvious symptoms apart from a feeling of pain. So that's it for this video. I hope this was informative and you learn more about what exactly is RSI. If you have any questions or comments, please let me know in the comment section. Thanks.